thank you. Yeah, I think it's time to get started. We're 7 minutes past the hour. Thanks for everybody joining. My name is Marquis Allen, along with my co-moderator, Aaron Cohn. Welcome to the July edition of the Healthcare Roundtable. This is a free forum where we get together and we talk about technology, we talk about healthcare, we talk about blockchain, we talk about the intersection, and we talk about everything in between. So we typically have time for free conversation towards the end of the 2-hour block. But for right now, we want to get into Dr. Charles's presentation pretty quickly. But before I do that, Gerard, he's the director of the Government Blockchain Association, has joined us. And Gerard, I wonder if you can come off mute, and for literally 3 minutes, if you can talk about the initiative with the blockchain maturity model that the GBA is undertaking. I think this audience would be interested in hearing it.
Right. Thanks very much. And I want to hear what Wendy's got to say too. So I want to keep it really super short. The first thing I want to say is we just posted something on the GBA website, and we just did a press release on one of our panels for the event that we're doing, which is on funding blockchain projects. And just to give you an idea, the folks on this panel are going to be fantastic. Bill Rockwood, you can read a little bit about what he's done. He's written more legislation to fund blockchain projects than anybody in Congress. We're going to have Barry Johnson. Barry Johnson is with the National Science Foundation, and he's personally responsible for giving out grants. So if you guys are looking for grant funding, you have an opportunity to meet the guy at the National Science Foundation that has that responsibility. Vilma is an incredible investor. She's invested in over 60 different blockchain projects. One of her projects that she co-founded is valued at $2.5 billion. And then Ingrid will be there, as many of you know. Ingrid's a dear member of this particular group, but she also leads the U.S. Office of the World Business Angel Investment Forum. So before I get into that, I just want to let you know, if you're not planning on, and also Heather Flannery, famed, world-renowned healthcare expert, will be a speaker on the healthcare panel. So we're super excited about that. And also, Heather's got a key relationship with Symbachain, a GBA member. So they just reached out to us. We're looking for a place to put them on. So the event in September 29th and 30, blockchain and infrastructure. In addition to having a keynote who is a former advisor to both President Trump and Biden, he is the presidential advisor on infrastructure security, also responsible for healthcare and election security. He will be one of our speakers, along with Dino, he's a United Nations CIO. He has just been promoted to the United Nations Digital Transformation Working Group. So he's over every CIO in the United Nations system, which includes the World Health Organization. He's going to bring all of his CIOs together in October to brief them on the blockchain maturity model. So that's going to be every CIO. There's, I don't know, like 100 or 200 organizations and programs in the system. And one of the things that they'll be talking about is the blockchain maturity model. So in addition to him being a speaker, he's also going to be promoting the BMM across the global system. Now, the blockchain maturity model, for those of you who don't know, I'm just going to say, if you go to the GBA website, under resources, click on blockchain maturity model, and everything you need to know about that is there. One of the things that Marquis and I have been talking about is we need to create a healthcare supplement to the blockchain maturity model, like we have an election supplement, a banking and finance supplement. So that's as you guys wrap up the ethical design framework, that's a critical component. Also, I'm talking to Bill Rockwood. We're looking to introduce legislation in both the House and the Senate. Well, introduce language in the House and the Senate to state that the blockchain maturity model is a resource that acquisition officials may use to evaluate and select blockchain solutions.
All right.
And so
once
that happens, then we'll go back to the acquisition people, and they'll that essentially will become a discriminator. So sorry, that's way more than 3 minutes.
No, I was,
Okay.
I was about to play the wrap it up music, but you did really good. If you would not mind, please, sir, dropping that link that you mentioned in the chat so that people can peruse it at their leisure.
I'll do that right now.
And we look forward to talking to you in the future about the BMM.
Sounds good.
All right. Mr. Cohn.
Thank you everyone for joining us. Most of you guys know Wendy, but for those of you that don't, she is a friend, a mentor, and a colleague of mine. So I'm gonna let Wendy take it away and get started so we have enough time for the presentation. One thing we ask is throughout, if you guys have any questions, just go ahead and drop them in the chat. Wendy does have a handful of slides throughout that are gonna allow for questions throughout the presentation, but we ask that you don't interrupt. And then if there's any questions that aren't answered throughout, there should be a decent amount of time at the end to review questions or have deeper conversation about certain topics. So kicking it over to you, Wendy.
Well, thank you so much for inviting me. I am a fill-in speaker today, so I'm happy that I have an opportunity to connect with you all again. It's an audience of friends. So I am Dr. Wendy Charles. I am the Chief Scientific Officer at Burst IQ, and I serve on about 7 international committees that are helping advance standards or information for blockchain in healthcare. I am also a faculty member, and I teach graduate level classes in health information technology at the University of Colorado, Denver. And for my friend, Dr. Michael Fossil, I don't know if you can see this, but I have your book and I'm going to start teaching from your book, Electronic Health Records. And I'm so thrilled you let me know about it because it's amazing.
Oh, you are so crazy, but thank you.
Thank you. So starting out with some disclaimers, of course, I'm going to share my opinions. And so these are my perspectives, not necessarily the perspectives of my employers. I will also mention several companies by name, but these mentions are intended to be educational, informational, not promotional. It's just helpful for you to know when there are companies actually operating in the space. And these PowerPoint slides are my intellectual property and that of Burst IQ. And so I will not be sharing my slides afterwards, but I am happy to talk to you at length afterwards as well. So I wanted to give some quick notes about blockchain, just to kind of lay some groundwork since we come from different backgrounds and considerations. Unfortunately, in this time period, there isn't time for me to give a full introduction to blockchain. Largely, my goal is to talk about it in a way that we can balance this content between blockchain and the healthcare attendees who each bring different areas of expertise. And also, while I know that these two terms are different, I am going to describe blockchain and distributed ledger technologies interchangeably. I recognize that some people have very strong opinions about this topic, and so I acknowledge that, but for convenience, I'm just going to describe them as being the same. And last, I do use a lot of terminology for blockchain, healthcare, and life sciences industries. Please let me know if I somehow didn't explain something adequately. I also, in life sciences, the term data is plural. So I will be describing how the data are a certain function. And so that's not a misspeak, that's intentional. So also, as we talk about blockchain has evolved so much. And when we think about how blockchain is simply a set of tools and technologies, it's not any one thing, then we should recognize that blockchain has continued to evolve into a data engine with advanced efficiencies. And I'm sure that you've encountered this. I have definitely encountered in some meetings, people will say, oh, blockchain can't do that. Well, when blockchain is a set of tools and technologies that can be implemented any different ways, then the possibilities are really endless. And even in this group, we're seeing some really creative solutions about how people are using blockchain. So I just ask you to have an open mind about how blockchain can be used. So today I'm going to cover the following topics. I'm going to talk about how health data have value, how health data sets are assets, also that these data sets can be valued and monetized, that data sets can also be tokenized and managed using blockchain. And I will offer a lot of details and recommendations for how to think through the potential sales of data sets responsibly. And ultimately, all of this is geared around the fact that we're seeing is a paradigm shift in health data value, and that we're starting to think about data within the context of a new data economy. So what is a new data economy? There's lots of different definitions, but to consolidate in some ways that I think this audience can relate to, we can consider it to be a global digital ecosystem of individuals, businesses, and governments that get together and organize and share data from a wide range of sources. But what makes this a new data economy is that data have value and can be leveraged and exchanged for payment or services. And the primary goals of creating a new data economy is not only can we use data in different ways, such as gleaning richer business insights or providing our patients or consumers with more data-driven services, but this also allows organizations to offer free or lower cost products in exchange for their data. And this is something that we encounter every day. Have you ever downloaded a free app? That app does not cost zero to produce or manage. Instead, the developers have used data for advertising and for sales in order to support their ecosystem. And so we are definitely seeing this today, and we're seeing more experiences of organizations establishing with data. So when we think about data for healthcare and business, we're very familiar with how data are used for healthcare provision and all of the different ways that healthcare organizations also have to manage their quality and capabilities for planning for services. But that same healthcare data can also enable business benefits as part of this data economy. And organizations are using healthcare data for some revenue, also to determine better business experiences, better customer experiences for acquisition and retention, faster innovation, especially in a research realm, creating new or more effective business models. And especially in research, we're seeing some of this data value create improved collaboration with partners and vendors. And this is not all that new or secret either. There has actually been quite a bit of press about how there is a new health data economy. And these are just some headlines from major websites, and which also were newspapers, and to ask the difficult questions so that we as a community can start thinking through about how this is impacting us in different healthcare aspects. So what is enhancing this health data economy? Well, as you're probably aware, health data sales are extremely profitable. In fact, the health data marketplaces have grown into a $60 billion market per year. And when the FDA released the real-world evidence framework in 2018 and continues to provide guidance about it, that pharmaceutical and device companies now have more opportunities for using healthcare data, health and consumer data in support of new indications for their drugs or devices, or for better establishing safety in post-market surveillance. So when there's a greater demand, then we also see much more growth in this economy. So for those of you not particularly familiar with real-world data, the FDA defines it as data relating to a person's health status or well-being or care as collected in real-world settings, such as the doctor's office or the hospital, as opposed to being in a clinical research center. And also, then when these sources of real world data are aggregated and leveraged and analyzed, they can be used as real world evidence. And the goal is to support drug development, clinical research, and determine value among different capabilities of drugs or devices. And there are many different sources that can constitute real world data, for example, from hospitals, mortality laboratory. There's a couple of things I wanted to draw attention to on the slide. So most people don't realize that public social media posts are mined for real world data. In fact, when I worked at Rocky Mountain Poison and Drug Center, we had performed REMS, so risk evaluation and mitigation strategies for opioid companies. And we were required by the FDA as their business partner to scrape social media accounts for mentions of opioid use and looking for people reporting adverse events. So this is absolutely done and can be used as part of real world data. And also, I'd like to draw your attention to the fact that we now have 350,000 health and wellness apps. And some of this provides excellent tracking of individuals. Even though the information is consumer grade, it can still be interesting and can be used to help inform capabilities. So I'd like to stop just right here to see if you have any particular questions about what I've mentioned. If you have specific discussions or arguments, I'd ask you to wait until the end.
I did want to just interject. I really liked your starting comment that blockchain is a set of technologies that achieve a certain purpose. And immediately I went to some of the conversations I've been having with people about the definition of Web3, which isn't just one thing. It's an amalgam of things, and blockchain can be a component of a Web3 strategy. And so I appreciate that. You know, that was important for you to mention. Yeah, I don't see any questions in the chat.
Awesome. Okay. Well, I'm going to stop about 7 times. So consider what your questions are. You can put them in the chat, and I also will be stopping to ask for your questions. And again, if you have a heated debate, let's wait for that to the end so that we can engage in deep discussion. All right, so for my next section, let's talk about health data value. And it's valuable to ask, how much is the health data worth? And can health data be considered an asset? Well, starting out with an asset, it absolutely can be considered an intangible asset. So for those of you not familiar with assets, an intangible asset doesn't have physical properties, but can still provide benefits to an organization and add to the organization's value. And so as you can see on the right side here, I listed some examples of intangible assets that companies have, such as patents, licensing rights, or brand equity and trademarks. So all of those are intangible, but absolutely add value. And it's important to know that data sets themselves add to the value of a company and are absolutely part of the valuation when a company is sold. So sometimes organizations ask, well, can we add this to the balance sheet? And the answer is mixed. And I'm not an accountant, so I am going to repeat what my friend and colleague, Brooke Delgado, has taught me about this, who is our Director of Finance at First IQ. She explains that no, we can't add data sets to the balance sheet if they're developed in-house, because we would expense those as they occur. But yes, absolutely, we could add those through if there's a purchase of a company or even a purchase of a data set. And so how would we create valuation? There's actually several different methods, but for the brevity of this conversation, I'm only going to focus on 3: the cost approach, the income approach, and the market approach. And starting first with the cost approach, this is where organizations create data values based on the actual or estimated costs of what it would take to prepare or replace the data set with a similar type of data set. And so many times I think of this like when we do NIH data tracking, it is the time and effort expenses that staff would report. And so it can be the salary staff. And remember, there's parts for cleaning, processing, and integrating with other data. And we can also include the actual cost of storage, because storage is not free. So organizations may also have costs from creating comparable data sets. And that doesn't mean doing a clinical research study. It's more about aggregating and preparing data. And it can also include the actual price that an organization paid to acquire the data set or as part, the data as part of a company purchase. So as an example of this, under HCUP, which is the Healthcare Cost and Utilization Project, they sell data sets, massive data sets, basically at cost basis. And these data sets range from $200 to $1,000 per database per year of data. And the goal is not for this government agency to make money. The goal is to create a sustainable environment where organizations and researchers have access to this data at a reasonable cost. Next, the income approach is trying to quantify the potential value and economic benefit generated from the data set. And there's two ways that this can be done. So the commercial opportunity is where a company would estimate the increased revenue that they could get. So as an example of this, like a pharmaceutical company might acquire data, real world data, so that they can have evidence that while the drug was prescribed off-label to a particular patient population, that patient population benefited from it. And so then that pharmaceutical company might estimate what could be the additional revenue if they are able to change their package labeling and market to that particular indication. So next is the economic uplift, and this is a really hard one to estimate. And the goal is to benefit to the intended audience for the products, such as like how might this benefit the patient population in some way or the economy in some way. And so as an example of this one, the clinical research that is generated from the NHS, the National Health Services in the UK, are estimated to deliver 4.6 billion pounds per year in economic uplift to patients. So the last is the market approach, and this is the one that's used by far the most often, and that's estimating value using data value factors. So there could be different influences for data and comparing data prices across factors in the market. And so one way that you could determine a market approach is to compare it to industry benchmarks, recent sales, prior sales, and once you determine how much a record can sell for, then you multiply it times the number of records. It's also interesting to know that there's a black market too. And health data are sold on the black market, and they are determined by a market approach using supply and demand. So how would we actually determine this fair market value? Well, as I mentioned, you can view public transactions, although very few companies actually publish what they pay for a data set. But you can create, you can request an estimate from a data marketplace that has offers the ability to buy or sell data, and you can generate, ask them for specific variables and determine what their pricing would be, and then perhaps for a comparable data set. And last, there are some companies that publish some of their market research or that publish their own security filings. And so this is an actual security filing from Luna DNA. And this is really interesting and really helpful about how this company has come to determine fair market value of data. And I'm putting the link in the chat for you right now so that you can access it yourself. And they not only provide estimates of fair market value for selling data, but also for how much individuals should be compensated if they contribute their data. Now, there isn't a lot of information available about specific data values. And part of it is because it's a closely held industry secret. And part of it is because the price that you could sell data depends on what people are willing to pay. And that depends on supply and demand. So these are just some rough ranges and estimates based on what has been published thus far. And you can see that electronic health records sell somewhere between $7 and $50 with a median 20. But it's interesting to know that on the black market, electronic health records do sell for more if they contain financial information. And the reason why these are so valuable on the black market is because they are used to steal people's identities. They're used to create fraudulent charges to Medicare, Medicaid for services not rendered. It could also be to find someone's financial information and use that fraudulently. So this last estimate for a complete genome resulted from a research study where individuals were asked what they thought a fair price would be to sell their DNA and their complete genome. So these are by no means the only ways of considering data value, because data depends on many different market-based value factors. So of course, when we think of supply, if an organization is interested in studying a rare disease and very few individuals would suffer from that disease, the data for that disease would be extremely valuable, a very high price based on the low supply. And also we see trends in demand that certain indications may be of hotter research popularity, and that drives the price up. Next, data complexity. If data set has a lot of variables, it can sell for more. Also, the extent of data cleaning, formatting, and normalization. Because organizations do often put in the effort to perform a lot of cleaning and to make sure that the data are all already normalized. It could also be some organizations perform verification of the data accuracy as well. Last, data set size. Of course, more records cost more. Data age is unpredictable because sometimes we need historical data, but newer data generally cost more than older data. Next is rights and licensing. If there's an opportunity for reuse, the cost will be higher. And last, some organizations charge different industries different prices because some industries tend to have more funds than others. So putting this all together in creating valuation strategies, typically organizations use multiple valuation strategies simultaneously. So in this hypothetical example, a medical center could enter a partnership with a pharmaceutical company where the medical center provides de-identified data and the pharmaceutical company provides algorithms and analytics and in exchange. And so the medical center might value their data by determining how much data have been sold in some public data exchanges, or they could calculate the cost of structuring de-identification and cleaning. So they might then create an estimate based on combinations of those. And the pharmaceutical company is naturally interested in determining what their market approach would be about, like how could they value their tools and what is the value of the tools that they're creating based on comparable commercially available services. And they could use the income and commercial opportunity approach to determine, well, how much more could we possibly earn if we created these tools from these data sets. Okay, so now I'm going to stop right here to see if you have questions about what I have talked about so far.
So far, nothing in the chat, but
Awesome.
you started unpacking a lot of stuff. I'm going to hold questions to the end. And if there's anybody with a financial background on the call, I think it'll be really engaging to talk about the value and all the things that you've been talking about. But so
I hope so, because I'm not an accountant. I'm a scientist, so I focus on those aspects.
Yeah.
All right, so I'm going to keep going then, and I'm going to talk about and start entering the capabilities of data sales mechanisms. So how are data sales often made, and how are data generated? So there's a couple different sources of how data come into creation. So of course, healthcare facilities have electronic health records or other systems for which they manage health data, and they do prepare data sets for recipients. It's very common for academic medical centers, for example, to help prepare data sets for researchers. They don't sell as often or directly, but it definitely is still a source of health data. Next, software developers and vendors. Epic, Cerner, Allscripts, these companies that produce electronic health record systems also have built-in rights to be able to access and use the de-identified health records of the healthcare organizations that use their systems. I hadn't known that Cerner has been selling our health data since 1999. Next, data brokers. These are individuals who are independent, and they are often approached by a company that wishes to obtain a unique data set that can't be obtained through some of the commercially available mechanisms. And so the data broker will facilitate a sale between some health data organizations that they are familiar with and the intended recipient, and then they charge a commission for engaging in that sale. And last, there are about 60 different health data marketplaces available today. Many of these have centralized mechanisms with some, we're seeing some emergence of some decentralized functions, but largely these organizations help manage the data so that you can have a shopping center basically for how individuals can come to buy and sell data. So of these health data marketplaces, I mentioned there's approximately 60 today. Health data, they can be platforms. Some only sell, some buy and sell. And these are highly specialized. And I did some more investigation before this presentation just to make sure that I was familiar. Most of them describe how they do meet HIPAA and NIST security requirements because they receive some data from healthcare organizations. Nearly all of them describe how they use audit trails to attest that data were not altered. Many describe how they use provenance to track data over time and look at access and usage. Many provide extensive cleaning, formatting, coding, harmonization. There's also tokenization, which means in this setting, applying a hash to a piece of identifiable information so that data sets can be linked without revealing identifiable information. Seeing a lot of data linking services, query tools, and because this is expensive, many of these control all of the costs of preparing data and managing the storage and exchange by using an economy of scale. And so like the ones I'm going to talk to you about, they manage millions upon millions of health records and billions of data points, and that's how they are able to remain profitable. So the first one is Prognos Health, and they actually spoke at the Real World Data podcast yesterday and talked about how they collect and generate and sell real world data. And even though this company has only been in place, I think it was 2 years, they have 100 billion plus lab results, medical claims, and representing over 325 million de-identified patients. Next, Truveta is a consortium basically of over 700 hospitals and more than 20,000 clinics representing 50 million patients across the US, across all demographics. You can see on this image, this is an image of their data coverage map of where those patients are located. And they perform extensive data linking services so that regardless of insurance, they're able to link across providers and claims by using, and they include mortality data, insurance claims, and they can also link with comprehensive social determinants of health data. So next, this is DataRaid. And if you go to their website, what you're going to see are a bunch of menus. And it feels like you're on a shopping website and you can shop. Let's see, you might want some electronic health record data. You might want some wearable data, combining those, might want some information about who the healthcare providers are. And you can't just purchase and download, you actually work with a data curator who manages the data set, just because there's so many variables and the curator tries to make sure that they understand exactly what billing codes you're looking for, or what ages, or any number of ways to limit the data set into a person's price range and make sure that they're getting exactly what they need. So it feels like going to Amazon, actually, when you go to some of these websites, because they have so many capabilities. And as we think about, those were only 3 examples. As we look at some analyses of the health data market characteristics, we see that there is quite a range, and this is an emerging market. I just wanted to point out 3 different areas that I found intriguing. So first, it's been determined by market analyses that this is a very competitive market, especially when we look at North America and the European Union, that there are a lot of players in this space already, and therefore there's a higher barrier to entry. And with any health information, naturally, there's quite a bit of regulatory complexity that has to be met by any health data marketplace. So I wanted to stop here and see what questions you have thus far. Okay, there being no questions, I'm
I
gonna.
think, oh, well, actually, something just dropped in the
Okay.
chat. Real quick, with regards to Cerner Epic having rights to use de-identified data, is this confined to specific countries? And I expect I know the answer to this one. Would this be applied to NHS
Yeah,
data?
so there's actually been quite a few publications about how NHS provides data to researchers. And they do charge for preparing data sets to researchers, but there is a mechanism for researchers to request access to certain data sets in the NHS, absolutely.
So far, a lot of stuff to delve into in the
Yeah.
open discussion piece, but
Okay, awesome. All right, well then I will keep going. All right, so after we talked about sales and how sales can be made, who should actually receive the proceeds of data sales? And there are a lot of individuals or organizations who are our stakeholders in the process. So should some of the proceeds go to the healthcare facilities that manage the electronic health records or other health systems that generate these data? How about the clinicians who use their professional expertise to make diagnoses or perform data entry about their findings? How about the insurance plans who pay for the healthcare visits? How about the software vendors like Epic, Cerner, Allscripts who provide the software and maintain it? And we don't want to forget about how about the people about whom this data is collected, the patients and consumers. So if we were to sell data, how would we distribute these payments among the stakeholders? So there are several different pricing and payment methods that can be utilized depending on what is the best fit for the organization, or they might use multiple. So first, some organizations might not actually be planning to run studies, but they want to assess feasibility, and that would fall under query pricing so that they can at least evaluate the data. Or there could be research and development pricing where an organization may ask individuals to wait until a product becomes commercially available and then share the profits. Where there's also profit and cost sharing splits, and some have argued for exceptions of charging exorbitant fees to nonprofits. So because this is complicated, I'm going to talk about two different types of value splits that can be used. So the first is a horizontal value split, and that's where you could divide the cost and fees across some of the critical stakeholders so that everyone receives a portion of the sale. So it could be the patient, the provider, the hospital, and insurer. A vertical value split involves differential payments. And this could be that patients who provide data of higher quality could receive more. And so think about how many patients don't even know what medications they're taking. They just know it's the purple pill, or they don't know enough about their medical history to provide reliable information. Or how about those patients who've had multiple tests and lab results and can contribute more information about the complexity of their disease? Or last, how about those patients who have been going to the same healthcare provider for 10 years and there's this wonderful longitudinal history about those individuals? Should they receive more? And so it's really challenging to determine a fair market value to patients. And of all of the estimates that we have available, there's really only one company that has provided the actual amounts that they give to patients or consumers who provide health information. So this is from Luna DNA, and this is from, you can access this information from the link that I put in the chat, where you can see how much individuals can actually receive for contributing specimens where the organization provided targeting genes. So these range from 70 cents to $21 for a whole genome. It's possible many companies could provide more, but this is from one company that submitted this to the SEC, and the SEC accepted this as being a reasonable estimate of a fair market value to give to patients. You can see that the estimates for RNA are quite a bit lower, whole microbiome is really a different thing, but patients could receive $3.50 for contributing information about their microbiome. How much could they receive for healthcare records? So currently, individuals who enter clinical data for their health records receive 7 cents per year. But if they generate a PDF from a healthcare organization, they can receive up to 14 cents per year of reports. And so these are some different estimates for different activities. You see, it ranges from 7 cents to 28 cents, depending on the activity. So of course, individuals, organizations can pay more, but this is one published method that had submitted to the SEC about fair market value, and they actually provide quite a bit of context as to how they came to these values for what they believe is an appropriate payment to an individual. So now I'm going to raise some questions about the complexity of this. So the first is, so if we're going to pay an individual for contributing their data or specimens, how do we pay them? So do we write them a check? Do we give them a badge on an app? Do we give them a gift card, debit card, utility tokens? Some companies give security tokens or cryptocurrency. So what is the best mechanism for doing this, with recognition that some of these have very complicated regulatory and tax implications? So next, if we're going to compensate individuals, we do have to know enough about them in order to compensate the right person. And so would maintaining some of this information increase the privacy risks to them? And be aware that in 2019, the United States IRS has specified that any income resulting from research participation, which is very comparable to what we're talking about here, is considered taxable income. And if an individual receives 600 or more in income from research purposes, it is taxable, and that the organization has to issue a 1099. So also, how do we monetize data in a manner that's both fair and visible to stakeholders? And the reason I put this in there is because many disease communities are really tight, and people are going to have different amounts of data, different quality of data. If there's a mechanism of paying people differently, those individuals are going to share and they're going to talk about it. And so you also need to implement the cost of an FTE in order to answer emails or phone calls about the people who are complaining that they didn't receive as much as Fred. So then we really do need to ask, can newer technologies automate some of this burden in order to make sure that we can manage this complexity in a cost-effective way? So I am going to talk about that in a minute, but before that, I wanted to go into the concept of, should data sale profits go to the data owners? So I'm actually, if that's okay with you, I'm going to jump over and go right into the next section about health data ownership, and then I will stop for a break. So this is so complicated. Who actually owns health data about both patients and consumers? So these are the different entities that often claim some level of ownership of the data that they maintain or receive. And I wanted to point out too that app developers are listed in here in addition to EHR vendors. So consider all of the consumer level data about wearables and tracking devices. So for example, who owns the data collected by your Apple Watch? Apple. Who owns the data collected by your Fitbit? Google, because they acquired Fitbit. And so it's valuable to consider how ownership is structured today. When we think about electronic health records in the United States, there are actually 22 states have statutes that specify that hospitals or physicians own a person's electronic health record. In only one state, New Hampshire, is it specified that the patient owns, but they only own the information in the health record. They don't actually own the health record. And there's a lot of limitations in New Hampshire as to what patients can actually do with this new right. They can't just walk into a healthcare facility and say, I'm ready to take my health record with me. I'm going to a new hospital. I'm going to take it and you can't have it. Well, of course, that's not permitted because of the need for continuity of care. And patients cannot, even if they own the information, they cannot request changes because that could jeopardize their safety. So it's limited ownership in that regard. Now, in the states labeled gray that you see there, there's actually no law that confers specific ownership. However, the courts have ruled in most cases that the electronic health records are considered the property of the healthcare system in which the care was delivered, because the electronic health record ownership is transferred along with the sale of the healthcare organization. So maybe instead we should be talking about data rights and what rights do people have to manage their health information? Or if we're thinking about using or selling that information, maybe we should be focusing instead on agreements for use that specify those terms and licensing about how this information can be treated and constituted. Now, we're definitely starting to see some changes to this. When we look at some of the privacy rights, we look at TEFCA, there's definitely a movement from giving simply rights to access into rights to sharing health information. And in 5 states now in the US, we actually have statutes that specify that individuals have the right to request lists of how their information was used. I don't know if it concludes sales because there's a special provision in HIPAA about how marketing is done and how explicit authorization is necessary for that. But it's possible that we could continue to see a trend toward more and more rights to this information. And some people say, oh, we're never going to get to the right to sell within a healthcare system. Not your own personal health record. But we didn't think GDPR would actually take effect, and it did. And now we see 5 US states with GDPR-like privacy statutes. So I wouldn't be surprised if some of the more progressive states try to move the needle on giving individuals more rights. So it's really valuable for us not to just say, well, I don't think this could happen, but for us to prepare ourselves for what if there are changes? How can we be prepared for that and to accommodate more requirements that we provide more rights to individuals? So along with ownership, why is this changing? Well, patients and consumers are becoming much more aware of health data sales or data sales in general. And you've seen the progress of legislation and statutes, and even in the Apple Store, consumers are required to be notified by the app manufacturer of what information is being collected about them. Also, we're seeing more societal push for data privacy and control, with individuals demanding more access and control. And last, if you ask patients who owns their information, patients believe that they own it. They believe that they own their data. And I think that's the underlying issue that's really driving some of these other focuses. So while we'd love to say, oh, patients should own their health information, well, maybe that will happen. But instead, right now, we can focus on data rights and control. And we can today utilize technologies such as blockchain to allow more patient level control and capabilities to make this much more efficient and effective. So I'm going to stop right here and ask if there are questions about what I have talked about so far.
Nothing in the chat so far.
Okay, I'm hoping that individuals are coming up with discussion points at the end, because I know that there are many perspectives and I'm eager to hear them all.
Yeah,
So,
I will interject really quickly that the concept that you're talking about, this debate on who owns the data, has been going on in healthcare for decades. I know that from doing EMR implementations back when I started in healthcare IT, that it was a hotly contested notion that the physicians own the data versus the patients. We could get into all the nuances of who has the right to that based on what they're contributing, but this so far has been really insightful.
Okay, great, thank you. Well, I'm going to continue then, and which will leave us more time to discuss some of these issues. So what could be the role of blockchain? Can this change the data marketplace landscape? There's currently between 20 and 25 blockchain-based data marketplaces currently in production. And these are only a sampling of those in production, but we know our good friends from Equidium are in the process of creating a data marketplace. And I'm really excited to see how that comes about. There's a couple of features of these blockchain-based marketplaces that I wanted to draw attention to. So the first is Indawex, and it's a commercial exchange where patients declare the prices that they charge for access and use of their information. So this is a lot like eBay, where people can post something for sale and they say, this is what I'm charging, and there could be potential negotiation, but it's an interesting mechanism where patients have more choice about what kind of funds that they could receive. And Enigma only allows calculations on encrypted data. Feels a lot like homomorphic encryption to me, but that's their privacy preserving strategy. And in Humanity, patients actually claim title to their data like it's real estate. And so they have official representations and documentation of how they have a title and manage their own information. So blockchain can provide benefits in many different areas. This is just a sampling of different ways people have talked about how blockchain can add additional value. And when talking about privacy preserving features, there is the possibility of using compute to data, which is what BurstIQ uses, and also zero knowledge proofs where okay, for those of you not familiar with zero knowledge proof, I'm going to provide a quick explanation. So while the explanation I'm going to provide, the example I'm going to provide is not perfectly accurate, at least will give you an understanding. So, okay. So with a zero knowledge proof, the goal is to be able to verify that certain information is true or accurate without necessarily providing the underlying information and knowledge associated with that data. And an example of this, which isn't a perfect example because the system is a bit more technical than this, but imagine a young person going to a bar. What did they have to provide in order for the bouncer to let them in? They typically provide government issued ID that has a lot of information on it. And that bouncer does not need to know your full birth date. They don't need to know your address or whether you're a donor. All they care about is whether you're 21. And so when you think about zero knowledge proofs within that context, it would basically be a mechanism to verify that a person is 21 without needing to see all of that information on a driver's license. So of course it's more complicated, but at least you can understand what is the premise. And the goal is with some of these emerging blockchain benefits, and BurstIQ has been doing this for a while, it's about running computations and algorithms within the system so that you never lose access, and you can do it without providing private information. And it provides these additional capabilities could involve monetization, it could involve refining algorithms and publishing algorithms, it could also be launching data marketplaces. So there's also a question, wouldn't blockchain also provide benefit because of its inherent audit trail and provenance? And so the answer to that question is actually, it depends. And the reason why I say it depends is because when we're talking about benefit, there should be some additional positive aspect beyond that which an organization already has. So absolutely, blockchain provides a benefit to organizations who manage their data manually, such as Excel spreadsheets or homegrown systems that don't have an elaborate data management mechanism. But when we're talking about systems that are meant to be regulated for FDA submission or EMA submission. So in the United States, they have to adhere to Part 11, 21 CFR Part 11. And those organizations have had to provide audit trail and provenance since 1997. And telling them that, oh, our blockchain is so great because we use audit trails and provenance is like telling them that we're so great because we use the internet. Um, they laugh like we don't know what we're talking about. So it's just valuable. Blockchain provides a different value proposition for organizations that already have inherent audit trails and provenance, such as also electronic health record systems. And they have a very detailed audit trail that also tracks all views because that's required by the HIPAA security rule. And so it's just a different proposition about using blockchain for these types of organizations. And when we think about electronic health records too, back up for some reason, one of my slides isn't showing. No, I'm going to keep going because I put that slide elsewhere. Okay, so then the next potential benefit of utilizing blockchain is the ability to create non-fungible tokens. And we're all familiar, we've been hearing about NFTs. For those of you not familiar with an NFT, I'm going to first talk about what is a fungible token. A fungible token is like currency. It's like a dollar. You can have a dollar bill or you can have 4 quarters and it means exactly the same thing. And if you start with $1 or 4 quarters and you provide 2 quarters to one person and 2 quarters to another person, they have exactly the same value and you can divide it up like that. So many cryptocurrencies are fungible in that way. But a non-fungible token is more like a painting, because you can't divide up that painting. You can't exchange one painting for another because they're not of truly equal value. So this is what we're talking about with non-fungible tokens or NFTs. And these are intended to describe ownership to assets, including data sets. And NFTs can also be assets in themselves. And so this ownership is tracked on the blockchain, where an organization can determine they take an asset and often have a representation of it as an NFT, which is recorded. And then all sales and capabilities of ownership can be verified by performing a query and confirming the ownership, and can also help facilitate additional sales. And NFTs are absolutely coming into place for data. In fact, the Ocean Protocol has code that they use, and they manage a data marketplace using NFTs. And they had also worked with the G20 OECD task force to promote the use of decentralized technologies such as blockchain for data management, including the involvement of NFTs that represent data sets. And we're seeing much more awareness and promotion of how NFTs can be used for health data sets, and how maybe an NFT is the mechanism by which people could monetize and profit from their health data. So I wanted to just quickly stop here and see if there are questions about what I just talked about.
So you're definitely speaking to some of the things that me and my team are focused on and intent on answering some of those problem statements. Elaine dropped in the chat, and I think we touched on this a little bit earlier in the presentation, but briefly she asked, are there any examples of platforms where individuals are selling access to some subset of their information? I think you mentioned a few.
The answer is, it is absolutely possible. And so it depends on how the marketplace is set up, but blockchain technology introduces the possibility of utilizing fine-grained consent. Some of us call it granular consent, where an individual has very specific capabilities of choice and how they can sell only certain variables, certain information in their system, and only of their health record, and only for a certain period of time. And it could only be for certain types of research or for certain research institutions. Where we see some limitations is that some organizations that manage a repository or a data marketplace specify some choice, but maybe not as granular as an individual might like. And so the technology, the blockchain technology is absolutely capable of allowing limitations on access. It's just that for business purposes, some organizations provide fewer menu choices so that they can manage a fairly consistent user interface. Burst IQ offers user interface for our developers and if they choose to do so, they can provide it to their customers that allows an individual to select anything. These are business decisions that organizations need to make about how best they want to offer and manage data.
Yeah. Good. Yes, please
Okay.
continue. Yeah.
Yeah, okay. All right, so now I'm going to go into considerations and recommendations. So I encourage you to get out your notebook because I'm going to provide you lots of meat. And so you're definitely going to want to keep track of different things I share. So first of all, when we talk about health data sale considerations and recommendations, there are lots of different things to consider across a spectrum of aspects, including legal, financial. So I'm going to talk about each of these individually. Now, first and foremost, we need to talk about who this information is collected about. And these are about people. These are often health records or wearable information about us, our parents, our grandparents. It could be about our children. And so we're not just talking about data, we're talking about people. And that should be the first frame of reference that we use when we think about health data and what can be done. And how would these individuals feel about finding out that their information can be used or sold? So among their perceptions, some individuals are interested in sharing their information for compensation. And surveys have shown individuals are very supportive of helping with research. But when you also look at the research that's been done about individuals' preferences and perceptions about data sales, you see a common theme that individuals say it feels unethical to sell health information. And a big part of that is the concern about privacy. So it's not just privacy about the technology, which is definitely a concern when we read about all the breaches taking place in healthcare today. But they're also concerned that people will learn very private things about them that they might not want to share. And they don't want their neighbor to find out that they have herpes, for example, or that they have a pregnancy. And that individuals feel violated sometimes when they find out that their information was used or shared in ways that they didn't expect. And also, we just looked at some estimates provided by Luna DNA about potential fair market value for what individuals could receive for their health information. And granted, any marketplace can provide more, but there are some significant and real costs to maintaining any type of repository or data marketplace. And so there isn't much margin or always much margin available to give back to individuals. And so it's very likely that some individuals would feel that the amount of compensation that they receive just isn't worth the amount of effort that they would have to put into uploading it. So to this, we just recommend that you create clear, informed consent terms and privacy policies about how you engage these individuals. And some organizations also engage the community, such as the disease community, and they do presentations like the Alpha-1 Antitrypsin organization to share with individuals about this is what we're doing, and this is why. Or when I was at National Jewish, we actually had a regular, like a quarterly event where we engaged the local healthcare community and we engaged people who lived in the neighborhood and representative of our patient populations to share what we were doing with their health information. And anytime you can give individuals more visibility into how their information is used, you can increase their comfort. And this is a good capability of blockchain. So next, talking about science. So we naturally want people to participate in repositories, especially when there's opportunity for future unspecified research. And there have been an emergence of databases and marketplaces that allow individuals to self-select into those data marketplaces by uploading their data. But from a scientific perspective, there's a huge risk of selection bias. And that's when anytime individuals self-select into any study, it's very difficult to obtain enough data or a sufficiently representative sample to make conclusive arguments about the outcomes. So when doing scientific research on health-related data, organizations often obtain their data from an EHR-based system so that they can have access to all patients who had been diagnosed with a disease to ensure that the data are representative. And of course, for research, we need the data to be normalized and we need it to be clean. And so it's often necessary to work with a company that offers that. And we love data linking. We would love to have as much data as possible. And so there are data marketplaces that specialize in offering additional data linking services and additional companies such as Datavant who can offer data linking services to help organizations connect a data set to more environmental public health data, can be linking across additional data sets as well. So next, some financial considerations. Of course, organizations would love to have more revenue, but there's a lot of questions about how to price data. So I asked this question to a data broker, someone who does data sales as his entire career. And he said, it is, you charge what the market will bear. I said, how do you know what the market will bear? And he said, you don't really. So the concern is that it's difficult for organizations to know how much they can charge, because if they charge too much, their prices are no longer competitive and they will lose out on the sales to other organizations that may actually sell the same nature of data. Also, it's harder to break into the data market scene when it's a pretty competitive place and you need quite a bit of scalability to be profitable or competitive, and I spelled competitive wrong. When you think about some of the early emerging companies in the blockchain data space, several of them have gone out of business. So along these lines, there are some real costs with preparing and administering data in any type of data marketplace in order to ensure that it has enough quality to be competitive. And it's also important for organizations that determine how they're going to price or even compensate individuals to have clear approaches for determining their fair market value. So next, about technology considerations, we are seeing that technologies such as blockchain can automate the data sharing and can automate some aspects of the monetization. But in any aspect that involves a person's private information, there should be some mechanism on how access is controlled so that unauthorized individuals don't have access to even the de-identified information. And next, researchers are very creative about reusing data. And so if your goal is to sell for each unique data set, how to prevent secondary uses. And that's where some organizations like Burst IQ implemented compute to data, where organizations can't download the data set, but you can come onto the platform in order to perform your analyses. So we just recommend careful analysis of blockchains and evaluate different opportunities for some of the data flow, governance, privacy preserving, and granular mechanisms that are capable. Now, some people say, well, what about data? You know, don't we have higher data quality if we store data on a blockchain? Well, the answer to that is, it depends. So remember that, think of the source. Where are you getting your data? So electronic health records are notoriously inaccurate. Most of the time it's because they're outdated, but there can also be typos and individuals may not actually take the medications that they were prescribed. So in fact, one study looking at the quality and accuracy of NHS data had found that it was about 40% inaccurate or at least outdated. And when we ask patients to enter their information, patients may not be sufficiently accurate or reliable either. And that how many patients really know what medications they're taking or what their full complete disease history was. So then we have to ask the question, have we achieved trusted data by putting inaccurate data on the blockchain? And this is really the zero state problem, in that we haven't gotten ahead by putting inaccurate information. So what many data sales organizations do is they can perform some verification by actually examining data that look like they're out of range or are outliers. They can standardize the data, make sure that the billing codes are consistent and appropriate. They perform some cleaning for data formatting. That's without verifying the accuracy of data, then I think we're just still in the situation of garbage in, garbage out. So next, regulatory considerations. Some people say, oh, well, you can't sell health data because of HIPAA. Wrong. HIPAA actually allows covered entities to charge a cost-based fee for preparing PHI. And this is within the marketing, specified within the marketing section of the HIPAA regulations in 45 CFR 164. Most data, however, are de-identified, and that regulation then would no longer apply. But regardless of what type of regulation, like some people say, oh, I created a data marketplace that's de-identified so that HIPAA wouldn't apply. Fine. But in the United States, the FTC's requirement about health data breach reporting still does. And there is concern that information that is breached will require under US Act reporting to the appropriate regulatory authorities, notifications to the affected individuals, and there are often fines. So even if HIPAA doesn't apply, the FTC regulations do to health data. And in a memo issued in, I think it was November of 2021, the FTC stated that they would start to strictly enforce the requirements for breach reporting for health-related apps. So just be aware that there could be more regulations involved than you had anticipated. So next, we talk about de-identified data. And most of the time we are thinking about the HIPAA safe harbor provision of 18 identifiers that would need to be removed to classify a data set as de-identified. However, it is increasingly easy to re-identify people. In fact, there are entire firms, data science firms, that specialize in linking de-identified information. And it doesn't involve much more basic computing skills to be able to find publicly available information to re-identify people. In fact, there's a Harvard researcher who was part of Obama's task force on updating HIPAA for the HITECH Act, who is devoted, her name is LaTanya Sweeney, and she's devoted her entire career to showing how data can be re-identified. So with regulatory considerations, we would just recommend you first start out with some really clear privacy policies that clarify exactly how you're managing data and how you are going to de-identify it. And this involves a thorough risk assessment and due diligence of your processes and the potential intended recipients. And make sure that your efforts for de-identification have been reviewed and sometimes tested if you are going to use this as a broad method. So next, these are legal considerations. And it's valuable to know that data sales have really been pushing the evolution of federal regulations and state laws. Part of this arose from the way that Apple and Google and Facebook were using our information, but these laws now apply much more broadly to different types of information. And for those organizations that say, I would like to create a token or some type of security, just be aware that not only is registration with the SEC required, but some US states require these companies to register as brokers in their states. And so Luna DNA, in that article that I had put the link for, they described in detail why they only work in the United States because of regulatory and legal purposes, and why they do not allow individuals from certain US states to participate. Next, many organizations are worried about getting sued, especially if there's a breach. So anytime you create or think about how you could manage data for data sales, we just encourage you to seek legal advice. Make sure that you're familiar with all of the acts, regulations, statutes. You have defensible data pricing. Sometimes data is considered intellectual property. There could be contracts, development of NFTs. You may want to talk to your attorney about that too. And then as the last major category of considerations, there are ethical considerations. So we talked about the legal and regulatory, but we also should consider the perceptions. And the public perception of data sale is that individuals have strong discomfort with their information being sold. And along these lines, I think about if you would like to sell data as an organization, what could possibly be published on the front page of the Wall Street Journal or any type of news media, because they will report a more sensationalistic view of this. So we encourage you to, first of all, provide the patients and consumers with more information so that there is transparency about what's going on, engaging the community and providing patients with more visibility. And I would like to add another recommendation to this is that as an organization, you also carefully reflect on your values and your mission and your vision for the organization and determine if any particular activity is truly consistent with how you have aimed to operate as a company. And all of this leads to the concept that what is legal is not always ethical. Even if you're following all the rules, it just may not look right or feel right. And so I'm going to give you an example of this that was major international news about 2 to 3 years ago. So what had happened is that in 2018, Google had entered into a partnership with Ascension Health. And Ascension Health is like, I think it's a Missouri-based healthcare organization. And the goal of this partnership was for Ascension Health to provide electronic health information to Google so that Google could create artificial intelligence algorithms that would help with predictive capabilities of certain disease, and that they would give those algorithms at no charge back to Ascension Health for using their data. And the intent for Google was to develop a commercial product where they could sell some of these algorithms to other hospital organizations. So in order to do this, they created a business associate agreement between Ascension Health as the covered entity and Google as the business associate that outlined the terms of sharing and protections. So what happened, though, is that Ascension Health didn't tell anyone else they were doing this. They didn't tell their physicians, they didn't tell their board, they didn't tell any of their patients that their health information was shared with Google. And a problem is that 50 million patients were involved, and that Ascension Health shared 100% identifiable information, all of the identifiers with Google. And Google insists that only a handful of their team members had access to fully identifiable information so that they could cross-reference, but that additional individuals would only do research, like their data scientists would only do research on de-identified information. Well, this story broke on the very front page of the Wall Street Journal in 2019, and it raised a furor among patients and physicians within Ascension Health. And part of it, I think, was that it was Google, because Google hasn't always been responsible with our information, but part of it was people felt violated. And so the heat became so bad that Google and Ascension Health CEOs were required to testify on Capitol Hill before Congress to talk about this relationship and the appropriateness of the terms. And so after a tremendous amount of scrutiny and evaluation, it was determined that this partnership was perfectly legal, especially since it was conducted under a business associate agreement. There were some details and policies that did need to be tightened, but it wasn't inherently illegal. But the failure was one of optics, in that individuals didn't understand and were not provided with enough information to be able to interpret what was being done. And it didn't hurt that, then it was also complicating that after the Wall Street Journal published, then a number of sensational media articles were published. So the big takeaway is that even if you have plans that could be determined to be legal, it may not be consistent with all of your own or the stakeholders' values. And so we just always encourage you to consider these perceptions among patients and even the media. So questions. So I want to see if there's any questions so far.
Yep, actually, we had a little bit of a conversation in the chat.
Okay.
All along some of the topics that you were talking about, the accuracy or inaccuracy of the data, the reliability of it, then the salability of it, and so forth. But one question actually was just dropped in from Elaine. If individuals are making the choice to sell their personal data and retain agency, would that not be ethical?
Well, ethics is in the eye of the beholder.
Yeah.
In my opinion.
Right.
I would just state that organizations typically perform and are encouraged to perform what's called an ethical risk assessment. And this is something that we wrote as part of our blockchain ethics playbook with the Government Blockchain Association, is that organizations should not rely on their own perceptions of what they think are right or wrong, but try to consider the ethics of the perceptions of the individuals that are included as stakeholders as part of the process, and that you consider also access to technology and whether individuals could be unfairly included or excluded in any data arrangement. And so it's just performing a thorough assessment of the potential perceptions and optics to cast a wider range on how people might perceive ethics.
Yeah, I would also piggyback on to that comment that if we're talking about the ethical perspective of an organization versus the ethical perspective of an individual to make that choice to sell their data, if my personal ethics on what that means conflicts with the organization, then that might bring its own challenges, especially from the lens of an organization trying to commoditize data in a responsible way.
Agreed.
Yeah. Let's see. Yeah, I don't see any other questions, just some commentary that
Okay, well,
when
I
we open
am
up the
looking
floor.
forward to jumping into all that commentary because I am almost done.
Yeah.
So I had just wanted to share a little bit about who I work for and just understanding the context of some of the discussion items I offered just when sharing my personal experience. And that First IQ offers life graphs as part of its blockchain technology. And a life graph is a digital graph of person, could be person, place, or thing. And it's a longitudinal representation of that person that creates knowledge graphs. And it can capture all of this data linking that we were talking about. And in these life graph networks, there's an ecosystem that use graph modeling and graph technology to empower intelligence algorithms. So it just shows blockchain has come a long way. And these are features that lend really well to some of the types of data marketplaces that we were talking about as well. And ultimately, our goal is to create trustworthy digital human experiences and hyper-personalized digital experiences. So if you don't remember anything else from this presentation, I hope that you walk away with the knowledge that health data marketplaces are increasingly used. There are about 60, but they come and go. These involve really complex advanced planning. And I hope that you realize, especially since we're in the Government Blockchain Association working group, that blockchain technologies can automate and implement some of these difficult facets for data management. So that is the end of my presentation, and I am eager to hear more of your thoughts and discussions. What did you like? What don't you agree with, so that we as a group can provide more insight.
Yeah, fantastic presentation. Georgia, you got your hand up. I want to hear what you got to say.
Marking, thank you.
Yeah.
Wendy, thank you. Just so illuminating. And if this opens a wider discussion, I don't want to monopolize the time. But first of all, comment on that example that you showed with Google and Ascension, I think. Common practice, the fact that this garnered attention is very helpful, but that happens and used to happen at least. And I've prevented some instances of sharing the identified data of, let's say, all of US consumers. So that is very common. I think what you are showing is that with decreasing the mobility of data, so the analytics coming to the data, some of that can be prevented, especially with tracing, access controls, and all of that. My question gets to then, how do we contemplate capturing the value of data? Right now, we use the language of selling your data. If we rephrase it somehow, we can think of tokenization, but then get into, okay, are we issuing a security? Gets a little bit subtle, but ways of capturing that data value and that creating opportunities for that value to somehow come back to the data owner. I think that would be really helpful to have a solution that maybe then can help us with how do we organize these marketplaces of determining that value.
I completely agree. And I will be the first to admit that I don't have a solid answer for that. One aspect that I could offer is that I am close friends with some data brokers who buy and sell data on a regular basis. And under a confidentiality agreement, they could give you some estimates of what they've seen in the market. But of course, it fluctuates and it depends on the data set, and it depends on the rarity of disease, depends on the patient population, all of those things. But I would hope that an expert in the field could provide you much more insight than I could.
Oh yeah, and I was referring more of thinking of, rather than thinking of selling data, which has all these implications, and putting a price tag. Maybe I get some kind of token or a coupon that I can then exchange as a patient for entry into a very high profile clinical study that's relevant for me. So the value isn't in dollars, but the value is in access or something else that has importance to me. So capturing that data value, I think that's where I was going with the tokenization. That's one way of doing it, but then when we start, or NFTs, but then when you get into that, we get into SEC and CFTC saying, wait a minute, are you issuing a security and doing financial transactions? And we see how crypto is going to get under the regulatory scrutiny soon. So it's very tricky and very subtle, but these marketplaces will benefit from that, so they don't become exchanging data as a pure commodity, which may be easier now because we have the framework the financial framework set up. But then the value, you're absolutely right. Then the dollar value of that data is really supply and demand decided, and intangibles like adding my social media data or any kind of derived data from my Fitbit tracker to my DNA to my participation in the clinical data trial. How does that increase my value? It's still supply and demand versus some kind of measurable way of saying, well, look at this complete data set, and somehow that capturing the value of the data. It was more of an open remark. I don't expect a concrete answer.
And you know, if I can interject, so Georgia, you bring up some really interesting concepts, because I think within the context of Dr. Wendy's presentation, she was talking largely about the organizational approach. Look, we're talking about $60 billion in health data sales And I know from experience that the two things that healthcare organizations make the most money on is their specialty procedures, and Dr. Cheryl and other physicians, you can back me up. It's specialty procedures and their data, right? And so flipping that paradigm so that the individuals, the data owners, however they end up being defined, become the beneficiary, the ethical concerns change. It's kind of like what Elaine had mentioned. If individuals are making the personal choice to market their data and they have a mechanism where they can secure it, they understand how to be a responsible custodian, and they can connect into marketplaces or forums where their very special data, because everybody is unique, right? Just like everybody else, right? So there's something about not even just your health data, but your experience that is valuable to somebody on this 7+ billion person populated planet. And so valuating data, which, as Dr. Wendy kind of elucidated, is a really complex nut to crack, especially when you're looking at it from an organizational perspective. Maybe there are some more straightforward value exchange opportunities, kind of like what you were saying, Georgie. If I want to market my data, instead of me making cash money for sharing my experience, I might be agreeable to using my experience to get me access into a program that could further my my aspirations or help in my care or something like that. But a lot of this is really, it's still wide open, and people are still trying to answer these questions.
Marquis, I'd like to pop in on that
Please
and
do.
segue
Yeah.
on that. So many of you know that I've got an Internet of Medical Things product, and one of the things that it does is dispense medications in the hospital, or will. And I've been grappling with how to monetize that product the best way. And I've been through NSF Innovation Corps, known as I-Corps. I've been scouring the Stanford models for sales from Stanford, from Steve Blank. And I've also been over at Y Combinator in their startup school, trying to listen to them about how to monetize products. And I have never been able to wrap my head around the data issue until today, Wendy.
Oh, thank you.
Yeah. What you said made total sense, but I could never conceptualize it myself. And especially, how does this tie into blockchain? Blockchain will evolve new sales models. And they talked about that at NSF, at I-Corps back in 2018. What are going to be the new models? And Wendy, you've got it.
Oh,
And I
thank
just
you.
have to say, wow. Well done. Not even well done, just like off the charts. Amazing. Thank
Yeah.
you.
It just
Oh,
opens up your
thank
mind
you,
to a
Dr.
whole different way of
Cheryl.
thinking. Yeah.
Mhm.
Well, I don't have all the answers, but I do have a lot of difficult questions.
And the questions are sometimes better than having the answers.
My hope is that everyone can walk away from this with some aha moments and realize that it might be more complicated than they had thought. But if this is a direction they want to pursue, then at least they have a roadmap for what to think about and what to plan for.
Yeah. Hey, listen, I also wanted to encourage people, and we should have mentioned it earlier, to drop your contact information in the chat so that those that want to stay connected with Dr. Wendy, with Dr. Cheryl, with Daniel, who had dropped something in the chat about his organization and what they're working on with Genobank. Please do drop your LinkedIn information, your contact information in the chat, and then mind that chat for everybody else's information so that we can keep connected. And we have these the third Thursday of every month, and we are consistent with it so that we can come together as a community and share what we know and share what we don't know.
And I am very eager to hear from those of you like Daniel who work in managing data sales, what your experiences are. And I'm especially eager to find out if anything resonated with you so that we can, that you can provide some more experience behind some of the talking points that I offered. So Daniel, what can you please share?
Yes.
Of course, Dr. Wendy, thank you very much. Maki, thank you very much for the opportunity to be here. So I believe the only thing is that we had the experience or already the experience with marketplaces like OpenSea, right? Or Rarible, right? For other NFTs. I think there is a very interesting path to learn because all those marketplaces are kind of, in my opinion, very Web 2 kind of oriented, which is like, my question would be why humanity has invented a way to decentralize the assets, and then we are getting back to a centralized marketplace. I believe Marquis gave some part of the answer to that because they are forums, right? And as a forum, I understand that. But my comment would be like, I think in the near future, it'll be not Equidium, not Ocean Protocol, no OpenSea, not like these specific marketplaces where we will be able to find the data. It's like Bitcoin, right? There's like all sorts of ways you can get Bitcoin, even from an individual, from a custodian kind of version, a non-custodian kind of version, and so on and so forth. But I think that to start, the idea to build marketplaces as a first kind of conversation with patients is going to be a good start. But in the future, I see just the data being freed because it's now standardized, right? If the NFTs kind of emerge as the international standard or the global standard, that would be fantastic, in my opinion. But then data marketplaces will tend to just disappear or just lose their importance, in my opinion, because now you can literally exchange data with your laboratory, with your medical doctor, with your family, with your whatever. I mean, like literally is like ubiquitous, right? It's so again, that's kind of my, because the other thing is that a lot of security concerns is if we again think to centralize the governance into just a portal, like OpenSea has many like issues so far, and I mean those kind of things. But this was an amazing presentation, Dr. Wendy, and thank you very much. And I don't know, maybe another discussion for
and thank you,
data market portals.
Thank you so much for your insight too, Daniel, and for sharing your experiences and observations. And I wanted to build quickly. I'm not an expert on Web3, but I agree that what we're seeing is a trend toward both decentralized storage and decentralized ownership. And so it's hoped that individuals would be able to store data on locations that they control so that you don't have to rely on a centralized marketplace, and that individuals would have more access and control over how their information is being used.
And you mentioned, I believe, one of the, I think.
So let's see.
Sorry, just one. Because I think the evolution of that, like you mentioned, the rare diseases communities. I believe those will emerge as DAOs, decentralized autonomous organizations, and they will, I believe, occupy this space because now the data is super contextualized, and then you don't need the marketplace anymore. But that's literally very difficult to just forecast, but just that is my thought.
Yeah, you know, there's an emerging health marketplace with a dire need, and that's long COVID. Long COVID affects 20 to 30 million patients. Contrast that with less than 20 million patients with cancer in the United States. So it's a bigger market, it's a growing market, and there's no FDA treatment diagnostic or cure. Can you imagine cancer with no diagnostics, treatments, or cures? It's a huge marketplace. There is Sadie Whitaker has a huge data set coming out of Solve ME, and that's for a related condition that affects at least 1 million people in the United States. A disclaimer, me as well. But I'd like to see how that evolves. And how that can be used. That is the long COVID got, the state of New York got $463 million to study the epidemiology of long COVID that they split among others. And I'd like to see some of that money evolve into patient reporting to get the data quality as good as it can be. That's my 2 cents on a dire area of need that is unaddressed at this point.
Yeah. Hey, Nina, you
Thank
have
you,
your
Dr.
hand
Cheryl.
raised. What would you like to add to the conversation?
Well, thank you, Marquise. First of all, I just really want to commend GBA and Dr. Wendy for your ongoing presentations and experts. When I first joined GBA, I think it was like a year or two ago, I had very, very little knowledge about blockchain, but very interested. And it's just like through these ongoing talks and the experts that you guys have, I'm really starting to grasp this and learn a lot. So I thank you. That's one comment I wanted to make. Much appreciated. You guys doing great work. And then also, Dr. Wendy, I'm interested in using data for poverty alleviation, and my focus is on the underserved communities and bringing natural health and wellness alternative health. So I would be interested in using it to see how these methodologies, when it comes to natural healing, if it helps improve health outcomes of underserved minority communities. And I just wanted to know if you had any thoughts on that, if you could share any information.
Yeah, and thank you so much for your efforts in this area. It's so important, and those communities desperately need more intervention and more help. So I will share an opinion, but I welcome the comments of the others on this call too. So for any typical data solution, you don't necessarily need blockchain, but because blockchain is a set of tools and technologies and it's software, not magic. But I do have experience in a particular project that's being conducted by Dr. Ann Ingraham, who's also a member of this working group. And she is designing a data ecosystem for individuals who are justice involved. And for those individuals, and her data needs, she determined that actually the Burst IQ blockchain was going to best meet her needs because she wanted to be able to connect multiple data sources and be able to link data sources and access permissions in a very granular way across multiple providers. And so what blockchain is enabling for those communities is a much more efficient way of managing the data across the multiple organizations and giving those individuals who were justice involved, who have a lot of, there's a lot of sensitive information about their past, not just their criminal history, but also oftentimes there's drug and alcohol dependency. And so there was a tremendous need for additional layers of security, sensitivity, and control over access to certain information. And so that's where I can anticipate that blockchain could meet your needs. I would love to hear from others about what you think as well.
Yeah, and Nina, I would encourage you to, and you've already been on our first Thursday of the month healthcare working group working sessions and for anybody that's a GBA member, the healthcare working group meets as a unit first Thursdays, and we work on building guidance and sharing our knowledge and then imparting it to the public as a public service. but definitely connect with Dr. Wendy, connect with Dr. Ann Ingraham. She's a regular fixture on our first Thursday meetings, and perhaps you can expand on your vision and the things that you're working on, Nina, and maybe it coincides with things that Dr. Ann is working on.
Great, thank you. Will do. I'll definitely do that. Thanks.
Yeah, Elaine, I've really enjoyed your questions in the chat, and I saw that you were noting that you're similarly interested in what it seems like is creating a social benefit of utilizing this technology for folks that have been unserved, underserved, have been passed over. I don't mean to put you on the spot, but you're saying a lot of the right things that resonate with me personally.
Mhm.
Do you mind talking a little bit about that? At any rate,
While we're waiting for her, real quick, Marquis.
sure.
Before we drop off, can you do two things? Can you talk about what the game plan is for next month for folks, like, maybe have a quick discussion about what topic you want to do next month? And then also, I just want to remind folks, for those of you that are GBA members, please log into the site, because we're talking about identity and privacy. One of the posts that were on the Identity Management Working Group site this morning was information about the United Nations is now very interested in taking a look at this, and our colleagues at the United Nations are interested in connecting with GBA members that have an expertise in identity. So that conversation is happening inside the Identity Management Working Group. So if you're not a member of that group and you're interested in the subject, please join. There's a link to his profile, and he wants to hear about who's doing what in the identity management space, and how he can connect GBA members to that.
Yeah, so as far as the upcoming things that are on the calendar for the healthcare working group, again, I said first Thursdays of the month, we have a working session where we're going to introduce some of the concepts of the blockchain maturity model, and we're going to start to ideate on how we as a group can provide some perspective as it pertains to the healthcare sector and what kinds of issues that they have to mitigate in selecting a solution, in effect, figuring out which kind of blockchain technology, if it's blockchain at all, would suit their purposes. We've also been continuing on our cycle to create assets for the blockchain ethical design framework for healthcare. We've been providing some of the guidance that we've been coming up with in conjunction with some other guidance that we've enjoyed from other organizations. The American Council for Technology Industry Advisory Council, IAC, has come up with a blockchain playbook from an operational perspective on what, in their case, their audience, government agencies would need to look forward to in instantiating a blockchain flavored technology process or project. We have taken their information and we've created an ethical layer on top of that to have that be a part of that consideration. And so we're going to continue on with those. As far as the next third Thursday meeting, my friend and co-moderator Aaron and I have been fielding requests from GBA members who have something that they want to talk about to present in some of the upcoming meetings, but we haven't nailed down who our next presenter will be for the month of August. But stay tuned. I'll definitely be putting that information out through LinkedIn and through other social media, and of course to those that are connected to the GBA and membership through the GBA global website as to who the next presenters are going to be, what the next topic is. I think that over the past several weeks, we've had this common theme about data as an asset class. I actually was having a side conversation with a friend of mine who opined that data is not an asset, or and I think maybe on another conversation, he could elucidate, but that the data or blockchain as a mechanism is merely the tool to share the data. And so, you know, as Wendy said at the beginning of the session, a lot of people have a lot of different kind of perspectives on what blockchain and innovative tech and data is and what it ain't. And that's one of the things that's encouraging about us coming together as a community and hashing this stuff out.
There's a joke in the blockchain community that if you ask 10 different blockchain experts for a definition of blockchain, you'll receive 11 different definitions.
11 or more. Yeah, same thing with things like Web3. And I kind of chuckled when you said, hey, I'm not a Web3 expert. And in my mind, my little voice said, who is a Web3 expert, right? The nomenclature just really started hitting the hype cycle within the past, I guess, 18 months or so. So I guess the takeaway is there's so much opportunity for us as a community to ideate on this stuff and come up with more questions and maybe come up with some solutions to some of the questions and invite other people to come along for the ride. Because goodness knows no one entity can do it all by their onesies.
Well, it's also kind of funny because you get a lot of people say, what's the best blockchain out there? And
yeah,
the only proper answer is for what?
Right, right.
I was thinking about Wendy's comment about the 11 opinions. The nice thing about blockchain is you can track down who had 2 opinions.
Right.
That's a great point.
Yeah.
Actually, the funniest way that I heard private permission blockchains really explained was you're basically building a digital nudist colony. People don't want that much transparency.
Yeah, that's true.
That's funny.
Actually,
wow.
Yeah. So we, as an aside, the DC chapter of the GBA had an in-person session yesterday at a location here in DC, and we had a very insightful speaker that talked about the crypto crash. It was very crypto intensive about the slant for blockchain, but we talked about whether or not some of these technologies are truly decentralized. And especially when you're talking about from an organizational perspective, from a healthcare organizational perspective, they're not interested in something that just anybody can get in and affect change on. They want to have those controls. That being a necessary evil, how do you maintain the integrity of the federalization of information so that that one entity that has my health records can't bogart complete control over it when maybe I need control for something because it's about me, you know? So answering these questions is definitely part of the intellectual stimulation that I get from being part of this community.
Marquis?
Yeah, man.
2 things. One, Wendy, in response to your question or Jim's comment, I put a link in the chat. So all of your answers about selecting the right blockchain platform will be taken care of there. But
Awesome.
no worries, simple solution. Just but Marquis, in light of the event that we had last night, we're bringing the chapters back online, and the idea behind a chapter is every month they do a different topic. So last month we did crypto crash, or this month we did crypto crash. Next month we're doing energy and mining. Why don't we do healthcare as at that same location? So we were in the home of a prominent blockchain billionaire who let us use his actually what
Very nice space. Yeah.
Yeah, he bought a school and turned it into his house. But it was a great location for both education and networking. So why don't we think, Marquis, about sometime in the future, we don't have to decide now, maybe you can talk about this on your next call, is to do kind of like a big meeting, a big small meeting, right? Not like a conference, but what if we did something where we invited members of the healthcare working group and friends and colleagues to that location. It's gorgeous. Yeah. Maybe we get it for a whole day. Yeah. And we talk about blockchain and healthcare as kind of like a little mini conference.
Yeah, and I think that would be a really good location for some of the healthcare entities in the DC area. So my team and I have cultivated the list of all of the providers and facilities that are licensed to practice medicine and bill Medicare. So just as an example, in DC, there are 12 labs. There are, 7.3 million entities that we can share this opportunity to sound off in a public forum, get their questions answered, have their answers reviewed, and build this technology as something that could substantially help the community. Because I think maybe we're all in agreement that that's what our aim is. I mean, yeah, it's nice to make a buck.
And
But
Mark, you went one more thing. In light of the community that's there, so we had a couple of people talk about his desire to serve underserved communities. That theme would resonate extremely well with that location and that community.
I agree.
Especially if we talked about sort of public health and serving underserved communities with public health. So you can sort of think about what you'd want to include, but I'm thinking if you had a day where it was a combination of informational presentations, an opportunity for people to showcase their blockchain healthcare products and services, and some social networking and that's nice food and drink so that people could relax and just kind of get to know each other and build relationships. That would be an outstanding thing to do.
Build relationships, yeah. And you and I know, Gerard, that's what we got into this. It's to build relationships between people that can share this information.
Yeah.
I know that we're past the time. I want to be respectful of everybody's time. We will be sharing the recording of the presentation within the next week or so.
So if you take a look at this chat, and by the way, we have a healthcare playlist. So what we're starting to do is, when you guys do these events, we're recording and putting them under the healthcare playlist, so you can go back and hear previous ones.
Yeah, that would be really good for anybody that missed the conversations with Solve Care, with Equidium Health, some of the other blockchain-centric, healthcare-centric organizations that are GBA members. There's a lot of really interesting perspectives and information in that playlist. So I encourage everybody to check it out when you can. This one will be done by Monday, as our esteemed webmaster has just committed to. So be looking for that. And again, hit me up on LinkedIn. Give me a holler. Most of you guys have my personal information, my cell phone and that kind of stuff. So if you ever want to nerd out about this stuff or figure out how we can crack the code on making this technology viable and useful for the greater good, I'm for it. So with that,
Mark,
thank you for.
you shouldn't be giving out your phone number. You should be selling it or giving us tokens. Just
That's
yeah.
right.
That well, there's